Welcome back into the Keep Boone Healthy Facebook page. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce, and today we are talking about WAMY Community Action, and we're joined by Melissa Soto, the Executive Director, to explain yet another great community resource that is going to come into our daily vocabulary here as we move into a new season, and we see people throughout our community that are dealing with challenges that WAMY will be able to help answer. So we wanted to help map that out a little bit today, as well as update folks on how WAMY has had to pivot even during their own COVID response. So first of all, Melissa, thanks for joining us today. I hope all of you and your staff are healthy and well at this point.
Thank you, David. I'm excited to be here. We're all doing great, and I'm eager to tell you all about WAMY.
Well, let's start there. For anybody that might not be as familiar with what WAMY Community Action is all about, can you give us the elevator speech about what it is that you all do every day to help our community?
Well, I always like to start with what's a WAMY, because that's the question that we get asked every day. And it's really very simple. WAMY just stands for Watauga, Avery, Mitchell, and Yancey. Those are the 4 counties that we serve. And basically, we're an agency that's here to help people rise above poverty and become self-sufficient. That's what we're all about. And a lot of people may know who we are. A lot of people may know who we were. Our programs and services will change over the years to meet the needs of our community. So we do an assessment every 3 years to see what these specific community needs are, and then we create programs and services to meet those needs. Currently, we have programs in 3 major areas. We have housing and energy, where we do repairs, energy efficiency, heating systems, those kind of things. We have youth development. We do summer camp and after school in Avery County. And we have family development. And that's a program that helps folks who are trying to increase their education so they can earn more money in the long run. So those are our 3 primary programs that we're working on right now.
So obviously the last 6-7 months have been very busy for you and your staff. Can you tell us a little bit about how your need for services and really the way you were able to administer services through some of those programs changed as we all evolved in the COVID-19 protocols?
Sure. I think in a lot of ways, I don't think it really affected us in as much of a way as it did some larger agencies. Although we serve 4 counties, we're only 13 staff. So it's not as hard to wrangle 13 people as it could be 50 people. And we're kind of used to being responsive and being able to turn on a dime, because that's just the programs that we offer. That's just what we do. So it wasn't so difficult for us to pivot quickly, and we're never really an 8 to 5 agency anyway. So, when all this happened, we just kind of mobilized really quickly. We already have drop boxes at all of our offices, so it's easy for folks to drop paperwork off and those kind of things. We're still not open to the public, but we do have staff in the office. Some are still working remotely part-time, but we never missed a day. We never missed a beat. We're still there for our customers. We're trying to make sure they know that. We have an 800 number they can call. If you call our office, those phones go directly to our email. So we're actually accessible 24 hours a day to everybody. So yeah, it's really affected all of our programs profoundly. The Total Family Development Program in Watauga County serves an abundance of students, of course, low-income students, first-time college students who are already struggling financially. So of course, when ASU and Caldwell decided to go from in-person classes to virtual learning and kind of sent everybody away, I don't think folks realized what that meant for those students. Basically, some of them were homeless. I mean, when they had to leave the dorm, where were they supposed to go? A lot of them. Some had leases that they had to continue paying whether they lived there or not. They relied on work study for their income, and that was gone. They had no infirmary to go to, so there was their health care gone. It was really tragic for a lot of these low-income students. So our financial resources for that particular program were depleted in a month and a half. So we had to rely on our community resources and our donors a great deal during April and May, especially, just to get those people back with their feet on the ground. But we did, and I think we were successful. Everybody made it through. And we did have a lot of folks graduate and find employment and kind of get settled down. We're taking new customers now, people who are still in there trying to get to school and continue on. We have a lot of people in that program who are going into healthcare, which, as we know right now especially, is very needed. And that's just one of our most successful programs. We have people with teaching degrees, human service degrees. Of course, healthcare is still one of the biggest career fields that people are going into. Our housing department, that one was really thrown for a loop, because the whole premise of that program is that we go into people's homes and we do an assessment of what the repairs that they may need, the health of the people living there, and what that house may have to do to affect that homeowner or that family. And so that all changed. Families were frightened for us to come into their home, rightfully so. So we took a pause with that program. We kind of had to rethink how we did things. But I would say within 2 weeks, we were kind of back in business, full Tyvek suits, head to toe, mask, gloves, not a speck of flesh showing anywhere. And there's still some high risk individuals that we kind of put on the list, and we're going to later, but we're back in business. We're doing as much as we can outside the home, trying not to go inside the home unless absolutely necessary. We're using extreme caution, but we're still repairing homes. We're still doing weatherization. I know that winter is coming up, and people are really starting to think about, gosh, my electric bill is really high. I need to get some insulation in my home. I need to get my heating system checked. Maybe they don't have a heating system. They need to still call us, because we're still helping folks do that kind of thing. We're still in business. We're not stopping. In fact, we're trying to put together health and safety packets for the families as well, so that when we go out to the home, not only are we protected, we're trying to make sure they are. So we're putting together these health and safety bags that include hand sanitizer, mask, and cleaning wipes, so that they have that protection. Probably 70% of the people that we help in that program are elderly. A lot of them are kind of shut in. So we want to make sure that they're protected as well. Go ahead.
Well, I was going to say, I want to get into that kind of winterization model here in a moment, because I know that that's always a timely discussion, let alone during a global pandemic. But, I know a lot of your work has centered around studying and dissecting all of these different House bills, grants, funding programs. I'll call them economic recovery vehicles that have been put into place to help get money to service providers. And I'm sure that is all very confusing for the average person to digest and see, oh, hey, I heard there's some money in a bill, but how that actually gets allocated can be very tricky because of some of the very narrow parameters of some of that assistance. How have you and your staff worked to kind of go fine-tooth comb style through some of that legislation and some of those opportunities for funding to make sure that you can spread those dollars around your various programs and impact as many of your clients as you possibly can, again, knowing that certain monies are probably only earmarked for certain elements of what you do at this point?
Well, it is confusing. It's confusing to those of us who do it every day. It's a whole different language. And so basically I spend a lot of my time reading these government documents. But yeah, we did get some money from the CARES Act, and everybody's heard of the CARES Act. That money went to a lot of different places. But a piece of it did come through one of our grants. And one of the things that we did with this is we were fortunate that it came through a grant that's very flexible, that allowed us to do some really flexible things with that funding. And so we took a portion of it, and we actually did memorandums of understanding to help other people, other agencies, because we knew we'd get more impact that way. So some of our funding went to help food banks. Some of our funding went to help food deliveries, educational packet deliveries, helping other agencies. Like I said, we're 13 staff. We can only do so much. But by helping other agencies, we were able to spread that money even further. So we got that money in July, and we've already served 516 people. We could never do that with 13 staff. So that's one of the ways you can take federal money and kind of spread it out and do more with it than just trying to keep it in-house and do one person at a time. But yeah, it's very confusing. Some of it can only go to local government. Some of it can go to individual agencies, and just having to sift through it and try to figure out how to get as much money into your community, as much funding into your community and to the right people. It's very complicated.
Well, and that kind of leads us to where we are today with a number of different agencies preparing for what is a seasonal transition here in Watauga County. And again, in normal years, that means a number of families that do have home repairs that need to be made, or trying to expedite those, trying to get heating systems in line, trying to get food sources in line if transportation becomes a little bit different ball game in a winter period here, as we all know it does. How are you all preparing for what is to come, with not only deploying those resources, but then again, working with other agencies to make sure that everybody that needs assistance is identified and can be routed based on their need to the right service provider that can maximize that opportunity to help in whatever way they can?
Well, one of the things that we're doing is we're trying to prioritize our funding. Right now, we're focusing on folks who are looking at evictions or foreclosures. We see that as the top need. We don't want anybody to be homeless. And we know that there was, like a 3-month period there where people could not be evicted. And so what we're finding is that people are coming in and they're owing 3 and 4 months worth of rent and mortgage payments, and $3,000 and $4,000 behind. That's a significant amount of money. So we're making that a priority. Utility bill cutoffs, those are also a priority. Internet cutoffs for people who have children who need that for virtual learning, and car repossessions. Those are the things that we are prioritizing with our CARES funding. And that's available to anybody who is 200% of poverty. And anybody can Google what 200% of poverty is. It's not that hard to figure it out, or you can go on our website. But those are the things that we're focusing on. Other needs, we're trying to refer out to WeCan and some of the other agencies in our area. And we're also taking those secondary needs and taking those to some of our funders to see if we can get some donations to help with those things too. But the need is so great. You have to prioritize.
Sure. And I'm sure, like many nonprofit agencies that are involved in COVID response, WAMY not immune to the fact that some of those key fundraising efforts, events, elements that you've been able to count on for years and years were not necessarily available in their true form this year. So how are you working to make sure that, aside from the government monies that you may get, that your private fundraising is coming along in a way that can help supplement some of what you're doing?
Yeah, we weren't able to have any of our fundraisers this year. And it's really been devastating. We've probably lost about 25% of our funding this year. And, grants are great, but they really are limited. They are our bread and butter. They keep us alive, but we know what our community needs. And so we really rely on community dollars to meet those specific community needs. And we haven't been able to raise those. We did do a annual campaign that normally happens in October. We've already done it. So we're kind of ramping things up a little faster this year. But yeah, we desperately need help from our community. We're looking at trying to do some virtual kind of fundraisers. I know a lot of people are trying to do that, but it's a new world. We're having to think a little bit differently now. Yeah, any help that anybody can give us is greatly appreciated. We're trying to get these health and safety bags not only out to our clients, but just out to anybody who's a shut-in. So if folks wanted to do a drive for these kind of items that we're having a hard time finding, imagine how hard it is for a senior who doesn't even get to go out to Walmart or the grocery stores. It's even harder for them. So if we can get these things into their hands, it's only going to make them safer. Fundraising has definitely been a challenge this year.
Well, and we'll make sure that in the body of the comment section below, there'll be a link to the WAMY website. You can check out any information that you might want to, if you want to get engaged, whether that's through fundraising or learn more about the programs. Melissa, my final question to you is kind of one that's a little bit more, I guess, broad-based in its ask, and that is, we live in a community that sees so many different types of people engage every day, whether that is our second home population, whether that's our multi-generational population that's been here since the county was founded, and we know where all of those folks are and how they provide such a vibrant element to our community. We've got students, we've got people that have done the Boone Orang and come back here. With all of that said, and so many different groups coming together, what would be your message to those that may not understand just how much that multi-generational Appalachia poverty element exists here in an area where you don't put that on a postcard necessarily? I mean, that's part of our operational knowledge, but it's not something that really gets talked about much. So what would be your message to those that may be in a position to help influence that in a positive direction, to say, hey, here are our needs, and it's not just COVID, these are everyday type realities that we go through here as a community?
I would say that when you're driving around Watauga County and you pass a house that you think nobody lives in, somebody probably lives there. The poverty is here. It's just not as evident in a lot of ways as it is in a city, but it is definitely here. I would say that the people who live here are proud people. They're not lazy people. 80% of the people we help have one job. Some have two, some have more. But I would also say that you couldn't ask for a better place to be and a better place to live. And that, you know, these people are your neighbors. And these people are the people that help you in the grocery store. These are the people that help you in your hospital when you have to go, you know. This is your community. Whether you're here full-time, part-time, however. These are your neighbors, these are your community. And I think the more we help each other, the better we all are. And I think, you know, I'm all about neighbor helping neighbor, or I wouldn't be working where I am. But I just think, yeah, I think Watauga County is a phenomenal place to live, and the people here are truly the salt of the earth.
Well, that's very well said, and very much a reason why we're all still here today. It's that neighbor helping neighbor mentality that got us through the tough times in March, April, and May, that give us the fighting chance to go into the winter with businesses still open, some people, you know, still having employment opportunities, and we only hope that those things get better as time moves on. So really appreciate everything you and your staff do to play your part in what is a very complex conversation, but you all do it with such class and execute so well, getting those monies and those informations out there. We are better for the work that you provide. So thank you very much for your time today.
Thank you, David.